Okay, so we manage an organisation called Awakening Minds, which is a CIC, a non-profit. We're here to create better community-based support services to help those institutions to serve our communities better. That's why we're here. We specialise in Punjabi services because 99% of the battle is understanding the person, the faith, the culture, the community, the feelings, the experiences, the trauma, the history. We're here because our experiences and we want to make it better. So what can you do? Do what you're doing now. Ask us, listen to us, talk to us, treat us like we're human. We're not hard to reach, we're here. Come to us.
In the South Asian community, the leafleting information or booklets do not really work, except for very few people. Maybe the National Service could try and engage with the South Asian community by visiting community centre where there are groups operating and have a slot during the activities. Also in the mosque on Friday prayers, they could have a slot during the service. Also the gurdwaras or the Hindu temples. In this way, people do listen, and the information can be put out there. If the National Service are reaching out to the community in the places I've mentioned, maybe the engagement could improve. I would say to my South Asian community that any offer of screening or a research program by the National Service or any other organization that do participate in them, it is for your own benefit, for short term and long term. If they catch up any symptoms of disease early on, the treatment is more effective and it works.
Yeah, I believe that a healthcare champion is required in all communities, for all communities, and use visual aids is a must because people do learn a lot from visual things, and interpreters as well, depending on which community you're targeting. And the other thing is that I want to emphasize is the fact that you need to have, because women, whatever background they come from, they're like the main people who think about the health for others. So they'll be the first point of call for getting people, women, to understand what screening is about. It's the understanding, it's the lack of understanding, and the fact that everybody needs to be sort of culturally sensitive as well.
Rather than the leaflets and things like that, we were doing that 30 odd years ago, you know. I think it's important that communication face to face and from the people who are actually well known in the community. In other words, these people are the scholars or the imams in the mosques know these people personally, would have better communication with the National Service.
With the diabetes, it's a lot hard, and the stroke, there are a lot of difficulties, but I'm trying to push them back. I need to go on the computer, do this, but I can't even say anything now anymore, and it's too late for me to learn anything now. Because I don't have the ability to do these things, and it's going to get difficult for us, for our age, or I don't know. We're not that old. I never learned the computers.
But the improvement is, again, is communication, accessibility to the place you work with, at least walk in or drive in.
We want to live longer, we want to stay happier, we want to be healthy, we want our children to thrive, and we want our families and communities and the nation to thrive. Come to us, sit with us.